We have a very eminent speaker today from South Korea. And I think everybody, those who have been involved in transplantation, must be knowing her, 𝐂𝐿. And she is today with us, that we are all fortunate enough to have her here on this platform. And just listening her, you will understand how much depth there is in her presentation. So over to you. This is great.
Thank you very much for your kind introduction. And I'm 𝐂𝐿, a nephrologist from Korea. And I would like to express my thanks to Professor 𝐕𝐵 and ISO team members for giving me this opportunity. Is there any timer for... Today, I would like to discuss with you overview of transplantation activities in Asia. I have no conflict of interest, but I'm working as a Secretary General, Asian Society of Transplantation, and other associations. I will divide my presentation into these 5 parts. When you look at the data of GODT of 2021, total transplantation activity rates is different by regions, and Asian regions represented by Eastern Mediterranean and Southeast Asian, and West Pacific is extremely low in comparison to America and Europe. The national country rate has been evaluated using GODT data from 2019 to 2021 to exclude the impact of COVID. And many countries, 35 countries, did not submit any data, even though among those 7 countries is performing organ transplantation. Among those countries that submit the data, the 25 countries shows huge difference in transplantation activities in Asia. This, if you look at this data by region, East Mediterranean region and Southeast Asian region and West Pacific region activity counts 11.9, 6.6, and 18.9. That is much lower than that of European data. If you look at the disease kidney transplantation rate, the rate is really much lower, especially in East Mediterranean and the Southeast Asian area, which account less than 15% of European activities. When you look at the kidney transplantation activities in Asia, data collected from 2015 to 21 to include the countries with minimal activities. 36% of countries are doing both living and deceased, and 12% do only living, and 7% is doing nothing for kidney transplantation. As you see here, total kidney transplantation activity varies a lot between countries, and only 5 countries, 2 from East Mediterranean and 3 from West Pacific countries, including 2 Oceanian countries, have mean activity over than 20.1, that is average of global activities. The rate of liver transplantation is a little bit different because the living liver transplantation activity is the highest in West Pacific area, even though the level of diseased liver transplantation activities is still low in comparison to European. Liver transplantation and living and disease has been performed in 32% of the total Asian countries. However, the activity varies between the countries. showing 2 countries from Eastern Mediterranean and 4 Western Pacific countries, including New Zealand and Australia, had more than mean activity of 6.4 liver transplantation in Asia. When you put all of these into the heat map, you can see the transplantation activities in Asia is heavily dependent on living donor kidney transplantation, but much less disease to donor organ transplantation. So in summary, the medical capacity for organ transplantation in Asia varies greatly by region and by country. Deceased donor organ transplanting activities are significantly reduced in many Asian countries. We all know that prevalence and incidence of ESRD in Asian countries, colored green here, are much higher than the rest of the world. However, as I've mentioned, the total transplantation activities in Asian areas are very low. To understand why we are doing much less transplantation, our society established a registry we call Asian Transplantation Registry, ASTRAC. ASTRAC has 3 main components. ASTRAC-N is collecting aggregated data from Asian countries, age from individual hospital date, and also we provide a platform for waiting list and others. ASTRAC-Age is a kidney data platform which contains 227 items across 5 domains. It has auto-validated platform and also have on-site visualized program. Before COVID, we analyzed 1,468 cases are all validated, and this data has been collected from 9 professionals from Asian countries. The characteristic represent 81% of South Asian transplantation data. Male proportion was 62%, and their mean age was 40.5, which is much younger than Korean transplantation data. Cause of end-stage renal disease, the most common one was glomerulonephritis of 52%, followed by diabetes and high blood pressure. The comorbid condition of the transplant recipient is very low because diabetes is 17% and the combined cardiovascular comorbidity was 1.5%. Donor type, deceased donor counted only 8%, and most of the donor was donated due to traumatic injury, a fall down or traffic accident that count to 65%. HLA-CDC cross-matching has been performed for T-cell in 71%, B-cell 6%, but the flow cytometry T-cell test was performed only 18%, B-cell 5%. So this ASTRAC data shows there are inconsistency in infrastructures, including registries and laboratory across the Asian region. The recipient populations are younger with potentially preventable cause of kidney diseases. Health inequality in Asia is a serious problem, as has been presented in many other articles. Organ transplantation also affected by health inequality. One of the main issues is gender inequality in kidney organ transplantation in Asia. It's not only related to Asian countries. As you see, this GODT data presents female overrepresented as a living donor, like in America and Europe and the Southeast Asian area. But male represent more as a kidney recipient for all over the countries. As Carrero reported in 2018, female has higher prevalence of advanced 𝐂𝐶KD cases, but they take less dialysis and they are putting less on the waiting list and then get less kidney transplantation. This pattern is really similar in Korea when we analyze the data using our database. To study this gender inequality in Asia, we developed an abstract with KT database, and the abstract sponsored by KOTRI, the Korean data registry. And also it has on-time visualization. So far, 10 countries are joining to this project, and as you see here, only Philippines has the female donor proportion less than 50%, and the Philippines has the highest global gender gap index compared to any other countries in Asia. Bangladesh and India has highest proportion of female living donors. Also, you can watch Japan, Korea, and Indonesia. The woman donor proportion is increasing. That might be due to female sponsor donors, and it ranged from 60 to 100%. But proportion of recipients in LDKT in all Asia is less than 50%. Bangladesh and India is the lowest, but this female proportion seems to increase in Malaysia, Indonesia, and the Philippines. We asked 21 participants who joined this workshop about why it happens. Except hypersensitization, many participants agreed that social factors in Asia might be the main influence factor for this gender inequality in Asia. Economic factors cannot be ignored in Asia either. Even though the WHO and the Declaration of Istanbul described that it is fair to pay the cost of proper procedures in organ transplantation, who will pay is a big issue in most low-middle-income countries in Asia. If countries with the universal coverage, no problem, but low-middle-income countries, usually recipient should pay the bill, then it usually causes inequality in medical care. To elucidate the impact of economic inequality, we evaluated the total kidney transplantation activity across the Human Development Index. Not only global, but the Asian data also showed very good correlation between HDI and the kidney transplantation activities. But however, in Asia, we needed to note that 52% are below the green trend global line. That means that needs to be improved. If you divide in living and deceased organ kidney transplantation, this gap also counts 73% of Asian countries. There are other factors than economic inequality. When you look at this main trend line, you can find the gap exists, especially in DDKT. And for the LDKT, it's also, you can note it, that Asian can do a pretty good living, but there are room for improvement for DDLT. So this section can be summarized that socio-economical inequalities like gender and economy strongly influence organ transplantation activities in Asia. However, there is room for improvement. This situation leads unethical organ transplantation, and many countries are on the watching list. So, as you know, Madrid resolution suggested self-sufficiency for three elements of increasing organ availability, ensuring fairness and justice and transparency, and preventing the needs. So we had established the Vital Link Asian donor workshop, and with the WHO and TTS, it can be an annual effect. And the Asian participant picked up 6 action targets of networking, national policy, professional education, DB, public awareness, and service resources. Among those, national policy is the target, and this is not established in many Asian countries. So the last one is there is an urgent need to establish a government-led national organ transplantation system, especially for disease organ donation program in many Asian countries. Thank you for listening.
Thank you very much, Dr. 𝐂𝐲, for your excellent presentation. And time permits for some of the question answers. So, just I have one query. Why there is so much of the gender disparity amongst the donors and recipients, particularly in Asians, and that too you have shown this bar is very high for the Indians. So, you have any suggestions on this platform to how to improve about that?
We evaluated both biological and socio-economic factors, but we didn't get any data yet because it's more complicated. Biologic factors are very important, such as high sensitization, and the female get frailty, so they usually cannot take the organ transplantation. But the social factors, usually men are breadwinner in Asian society, so they would like women to donate to their son still. And the huge issue is economy, and they would like to keep the breadwinner instead of woman who can be a housewife, survive with dialysis.
So, you immunologically, when you see who would be the better donor, one husband or wife?
In Korea nowadays, it's 50-50 more, but we really hope that, the male-dominant society also should think about the role of women and regard them respectfully and keep their health very well so that the society can be more harmonious.